to ask the Minister for Health and Social Care what plans have been put in place to ensure there is sufficient hospital capacity for the TT.
Minister for Health and Social Care to reply.
Thank you very much, Mr. Speaker. TT 2022 will be the first major mass gathering event held on the Isle of Man since the start of the pandemic, and the first motorsport event held since the Manx Grand Prix in 2019. TT 2022, as with all motorsport events, will be overseen by the Department of Enterprise, governed by the National Motorsport Committee. Representatives from both the Department of Health and Social Care and Manx Care are represented on the National Motorsport Committee, and this is the conduit by which any issues relating to the provision of healthcare to the event are relayed. A hospital TT planning group has been established, which includes attendees from key departments across Nobles, plus representation from Aintree Major Trauma Centre, to ensure issues around staffing and capacity, along with staff training and emergency preparedness, are tracked and resolved prior to the event. One effect of the pandemic is Manx Care vacancies have risen to 19.7% of the workforce due to increased difficulty in being able to recruit substantive clinical and support staff. Whilst Nobles Hospital has always relied on additional staff to support our workforce during the TT, this reliance will increase significantly during 2022 in order that we can cope with the additional demand during the TT fortnight. Additional staff being recruited include 4 orthopaedic surgeons, 4 emergency department doctors, 6 emergency department nurses, and 8 paramedics. As has been the case with previous TT events, all elective orthopaedic surgery will be cancelled during the TT fortnight in order for surgeons, theatre and anaesthetist capacity to be allocated to the likely increase in orthopaedic trauma presented through the emergency department. In previous TT events, orthopaedic trauma has been accommodated on Ward 11, which is the orthopaedic trauma ward, and Ward 12, the elective orthopaedic ward, giving 31 beds in total. However, currently Ward 12 is allocated as the COVID escalation ward, which will restrict trauma capacity to just 16 beds on Ward 11. Should trauma demand exceed the capacity within Ward 11, trauma cases will be accommodated on other surgical wards across the hospital. However, this may impact on other planned surgical activity. In terms of non-trauma demand, the access and capacity team, supported by the clinical and managerial teams, will be working 24/7 during the event to oversee demand and capacity across the Noble sites to accommodate people that require admission into hospital. A TT safety hub will take place on all practice and race days so that hospital status can be assessed and indication given to racing authorities as to whether the hospital is able to support that day's scheduled racing. Variables assessed will include staffing across key areas such as emergency department and theatres, the status of the Aintree Major Trauma Unit, the COVID inpatient situation, overall demand and capacity of the hospital, and the status of the Isle of Man Air Ambulance and GNAAS HEMS service.
That concludes questions for all answers this morning.